Nutrition and Disease Project. Topic: Emphysema by Daniel Kohler, 7th hour. The most common symptoms prevalent among emphysema patients are clearly breathlessness, coughing, and wheezing. These symptoms typically worsen gradually over the years the patient has emphysema. There are many other symptoms. Weight loss, for instance, is a common symptom since eating fuller meals can make it much harder to breathe since the stomach expands and pushes against the diaphragm. Fatigue, which leads to a lower level of oxygen in the blood, is also another prevalent symptom. Additional symptoms include swelling of the feet, ankles, or legs, being more prone to sicknesses and illnesses like the flu, and greater difficulty doing physical activity. Because of their bleakness and sheer noticeability, such symptoms hinder a person's ability to live a desirable life. Emphysema is most particular in those above the age of 50. Although men used to be the ones most prone to the disease, women now lead men in population of those who have emphysema. This disease is prevalent throughout the world since tobacco consumption and pollution are rampant. Because of these two factors, America has one of the largest emphysemic populations in the world. Yes, emphysema can be hereditary, but most oftentimes it is not. Emphysema is typically caused because of excessive smoking and environmental factors not controlled by heredity. In those rare cases where emphysema is inherited, the disease can pass along both the maternal and paternal side. In spite of not being able to cure the disease, a healthy diet will generally help the well-being of those with emphysema. This dietary objective is meant to help a person with emphysema to not become fatigued, and thus not intaking excessive oxygen, which is the primary nutritional problem. Tips such as consuming less sodium and eating smaller portions can often benefit the well-being of an emphysema patient. Above all, emphysema shortens a person's lifespan and affects his or her quality of life as the disease progresses. It is observed that only 5% of emphysema patients do not die after 12 years of their diagnosis. Other future results of emphysema commonly include pneumonia and cardiovascular issues, which can often lead to imminent death. A healthy diet, however, is known to combat such future possibilities. Due to the fact that emphysema isn't curable, this makes treatment the only viable option. Common treatments of this disease include the quitting of smoking, learning better breathing and nutrition techniques, the inhalation of steroids, breathing through a bronchodilator, and many more. As the disease gets worse, a 24-hour supply of oxygen is needed. Such oxygen is supplied through the use of an oxygen tank. The daily life of an emphysema patient most often involves chronic fatigue, pain, and personal embarrassment. Fatigue and pain are prevalent primarily because they are significant effects of the disease. Personal embarrassment most often sprouts from the public use of an oxygen tank and also the very noticeable symptoms of the disease. Some famous people affected by the disease include Leonard Bernstein, Dean Martin, and Johnny Carson. Works cited page. Image citations.